Good morning, everybody. It's Tuesday. It's a cloudy and windy day, but we've got Keith feeding, Ryan working with Riser, and then the vet team getting ready to start their day, so let's start the day. Hi, Buzz. Hi, buddy. What you doing? I think this one is Roxette. Good morning. Keith is scooping senior feed right now. Good morning, Keith.
Good morning. I'm sorry if I ruined your shot.
You're fine. I'm gonna just get you dropping in the food. They each have their own bucket, but they're deciding to share this morning. Well, I'm gonna put a few treats in for Isla and them, but let's see. Y'all want a few treats? I'm just gonna put a few right here, okay? There you go. This is Star. Good morning, Star. And then we got Nephra. Hi. Horses knocked the lid off. Easy fix, easy peasy. Done. Okay, we're at the 10 acre now. I didn't get to show you guys him feeding everybody at the 10 acre, but because we had a surprise adoption yesterday. Good morning, Waffles. Hi. Okay, so we've got the senior feed and alfalfa pellets. Weight gain here that they also take. Hi, buddy. You coming to eat? There you go, Waffles. Eat up. Cameo hasn't been doing too well. She seems to be like off by herself, but we're hoping that she's gonna start perking up. You wanna come eat? There you go. Get you some greens. There you go. Got some more. Everybody's eating their greens. Now Keith's putting out the weight booster. It's like a powder.
Someone threw away the normal scoop.
Oh.
So I'm down to a small scoop.
He said someone threw away the other scoop, and so it's like a small, tiny scoop now. Are you yawning? Another big yawn. Every time he does it, I stop recording. You got another yawn in you? Yeah. Okay, I'm not gonna stop recording this time. You gonna do it? No? Okay. Bo.
Likes your feed, but don't want to be caught. Don't want to be patted. Don't want nothing to do with anyone's duties.
He said, don't touch me. No.
Vet team has some really sad news to share with you guys about Honey, the little donkey who came in during a seizure / she was voluntarily surrendered back in August. Honey came to us in really, really horrible shape. She had wounds over most of her body. She had maggot infestations in some of those wounds. She was lame on at least 3 of those legs, and then her right ear was severely infected. She had kidney and liver value elevation and just a lot of other major concerns. She was borderline obtunded and not very responsive. So we've spent a ton of time with Honey and nursed her back to health. Her blood work improved. And she was doing very, very well. We actually had cleared her for adoption. And then unfortunately, last week, Honey presented acutely with a grade 5 out of 5 lameness. So she was basically non-weight bearing on her left front foot. Honey had horrible club hooves, so her conformation was very poor. We know there was some degree of inbreeding. We don't know how severe the inbreeding was, but we had taken radiographs on all of her feet and seen some really significant radiographic changes even when she first came in, but clinically she improved a lot. And so that's the big key for Dr. Gina and I is your quality of life has to do with your clinical health. We treat the patient, not the diagnostic. So the radiographs were pretty bad from day one, but she showed so much of a fight still and so much clinical improvement that we really fought through.
On Wednesday last week, she was, like Dr. Lydia said, 5 out of 5. On a lameness scale, we do it from 0 to 5. 5 out of 5 is non-weight bearing. She was very painful, non-weight bearing on her left front. So immediately I knew we needed to get pain management on board, sedated radiographs because she doesn't really like us very much. I don't blame her, but so that was the first thing we did was give her pain management and sedate her and then take radiographs. And comparing her left front to her right front, because you always want to take bilateral radiographs to compare to see, is this all legs or is it just one? Her left front was significantly more radiolucent on the radiographs than her right front, which is also a red flag, which means her bone is not as dense on the left front. And then when we really honed in and blew up on the image what her coffin bone looked like, there was a lot of resorption or lysis of that bone on the coffin bone. So she's bearing, equids bear 60% of their weight on their front limbs and 40% on the back. And so if there's any problem in that apparatus anywhere, it exacerbates the problem. And so when you're looking at the radiograph, her bone is being eaten away by some operation, either inflammation or something infectious, something like that. And so that apparatus is breaking down. And on the radiograph, if you look at it, there is so little bone there that the whole column is coming down to a point, even more so than normal on horse conformation, and especially compared to the right. So looking at that, it's a really big concern when you see those changes that there's potentially going to be a pathologic fracture, like one of the horses we had on intake had a pathologic fracture of the coffin bone, which isn't very common, so that's a pretty severe issue. And even with aggressive therapy, like digging out whatever's going on and giving her regional perfusions and things like that, quality of life, and then long term, will she rebound from this? Once that bone has gone to that point and she was that painful, aside from putting her into like a veterinary hospital, like a teaching hospital or a major facility where she'd be under 24-hour care, even then with that much care around the clock, her prognosis was very, very poor. So the thought of putting an animal that's already had a lot happen in her life, that doesn't really like people too much, and is in that much pain with that poor of a prognosis, the thought of putting her through all that just because we could was not really, that's not really what we're supposed to do. We're supposed to advocate for the animals and their quality of life and their level of comfort. So we gave her the pain meds and we put a poultice on there just in case there was a tract, I left that out. There's a tract at the point of the frog. And if you look at horse anatomy or equid anatomy, that is not a common place for an abscess to blow out, because they usually blow out at the point of least resistance, which is usually the coronary band or a point in the lateral sole, not at the point of the frog. And that is directly correlated to the point of the coffin bone. So whenever you see an abscess there, it's a red flag to think that there's something going on between the coffin bone and the sole. So based on her conformation and what we saw in the radiographs, we think there was some kind of either anaerobic or other type of bad juju, to put it in layman's terms, happening around the coffin bone. And with the conformation of her being club-footed and upright, there's a lot of tension pulling that coffin bone back from the the flexor apparatus. And because of all that, that's why it ruptured out there. But that penetrating tract was very deep, and we were concerned if it was something from the exterior going interior. We didn't want to put anything in it that could potentially go into the coffin joint or the coffin bone and make it worse. But after radiographs and looking at it post-mortem, it was something interior coming exterior. So at this point, there was nothing we could do to really help her feel better.
The family who was going to adopt Honey and Nancy together is still going to take Nancy home. But Honey went from being completely checked out and just terrified of people to, she didn't like to be caught or handled, but I would go eat my lunch in her stall a lot of times and she would eat out of your hand. And I think she felt safe and loved here. And I'm thankful that we did everything we could. Her ear healed beautifully. And it's really heartbreaking. And it's hard to share these stories, but we do it because we want to educate people about how to care for their pets appropriately, but also educate people about these sad stories so that we can do more as an organization to help prevent things like this from happening. We wanted to update you guys on the result of Winston's tests. If you followed Winston's story, it was very heartbreaking for our team. He came to us as only a 6-year-old. He was microchipped to the Jockey Club. And we actually were able to track down one of his former trainers. He was just an absolute sweetheart, and he was mostly healthy with us for over a month. And then he started developing rapidly progressive neurologic symptoms. So we do have the results back from those tests, and as is the case often in medicine, the results are a bit vague and can be open to interpretation. But to the best of my knowledge, we do have some answers. So Winston tested positive for 2 different diseases, both of which can cause neurologic disease. EPM, which is equine protozoal myelencephalopathy or myelencephalitis, is a hard one because you have to pair the levels in circulation as well as the CSF, the cerebrospinal fluid. And so his EPM levels were weak, and the lab's description for that was either the pathogen load was below detection or the isolate was a rare type, that the test wasn't as good as finding. So that was a positive. Whether or not that was a clinically relevant positive, we don't know. But Winston also had strongly positive IgG, which is a type of immunoglobulin, to West Nile virus. West Nile is something that we vaccinate for here at Horse Plus, and Winston did receive 2 vaccinations against West Nile. But the IgG normally doesn't stay elevated for more than about 10 or 12 days after vaccination. And Winston's second West Nile vaccine was administered on September 10th. And then his IgG results from October 10th were still very high. So the lab's interpretation was that Winston was definitely exposed to West Nile virus, but whether or not they were willing to say that he had active disease from West Nile virus, they weren't committing to. Dr. Gina and I just we have a sample of his cerebrospinal fluid, and also noted that there are particulate matter in that CSF. So that fluid should always be very clear and without anything present in there. But there shouldn't be anything in this sample. And see, when you rotate it, you got some little floaters swirling right there. So that is abnormal. Dr. Gina and I do actually a fair number of CSF taps. And so we're pretty good at getting a non-contaminated sample. I'll swirl it again so you can see those little, whatever they are, floating around in there. See the little particulate matter floating all around in there.
Oh, yeah. Yeah.
We didn't send for all of the possible tests with Winston. We're an animal shelter. In Winston's case, his clinical signs were heartbreaking. He could barely move. He was shaking. We weren't able to manage his pain. So our big goal as clinicians was to make sure that Winston didn't have a disease that put the rest of our horse population at risk. So we didn't do some of the other tests that we could have done on these samples, like we have in some other cases. But in my opinion, these two positives do indicate that we made the right call. We knew we made the right call without these, but that Winston had something significant going on, that the likelihood of successful treatment wasn't high with the degree of his clinical signs anyway. So just wanted to share that information with you guys. If it sounds like there's always a caveat, it's because pathologists love to put a caveat on those results.
I am on my phone waiting for a live video to start. High Forest Humane Society is an organization that we've worked with since we relocated here to Tennessee. We moved to Tennessee, started the process 10 years ago because there were so many animals that needed help in Tennessee, and the resources are very far and few between for animals. So High Forest is doing a fundraiser. It was supposed to have started a minute ago, a live video, and we have some donations to give them, and we're going to go support their fundraiser. Basically, this guy, Jordan's Way, he does live videos and fundraises, and I think this is the second time. Last year, I know some people, like, if X amount was donated, they got a pie in their face, or they ate a dog treat. I mean, I have no idea what we're walking into, but I did want to show support because they help take so many dogs and also now cats recently with their new director and help get them home. So we're going to go show some support, and I was hoping it would go live, but Chandra's going to talk to you about the donations we have for them.
We have got a whole sack full of brand new dog toys, leashes, and collars, and assorted items for dogs and cats. They mainly do dogs, but occasionally do take a cat. So I got some little things in there, but mainly all brand new dog toys to give High Forest Humane Society to help them out with their mission of helping save dogs. And they do a lot with Horse Plus Humane Society by helping us by taking our dogs and putting them up for adoption also. So it's a win-win situation. We work very well together and collaborate together so well. So we want to help High Forest today by donating them some brand new toys.
High Forest, it was, I want to say about a week or so ago, they posted they needed toys on Facebook, and I was like, oh, we have some at Horse Plus, because Chandra gets a lot of things donated, and she's so good at it. She's just going into the donation role. But you want to talk about the dogs with the heartbeat?
These are the Snuggle Puppies, and they're really awesome. I got 50 of them actually donated from Snuggle Puppies. So if you ever need a Snuggle Puppy, that's where you get them from, Snuggle Puppies. They open up on the inside right here with the Velcro, and you just pop them open. I can't open them. They're really Velcroed very tightly.
They're puppy proof.
They're puppy proof, actually. And you open them up, you put like a little heartbeat, and it puts them inside the sack. And you turn them on up to 12 hours at a time, and it actually beats like the mother's heart for a kitten or a puppy, or well, any animal really. So if there's an injured animal, you can even use them for them. And it's soothing, comforting, and keeps them warm and calm. So it's a wonderful, wonderful thing. And we want to thank Snuggle Puppy too for the donation.
Yeah, so we've used a lot of them here.
Yes.
But they take a lot of our dogs, and they put out an ask. So we're going to go fill that. I think y'all just have to tag along and see it once we get there.
So yeah, we're going to take all these toys to High Forest, and I think Lynn might be joining us.
You want to go? You want to go?
Never mind, Lynn is busy, so we're going to, me, Chandra, and Tawnee are going to go. So before going to High Forest, we stopped by where the new Spay and Neuter clinic is going to be. So we're checking on progress over here.
Construction is going to start in about a week. the contractor's telling me. Originally, there was a building right here where I'm standing that was going to be vamped to be the spay neutering clinic, like just revamped. And ultimately, it was such an old building, we just had to remove it. Originally, the building was going to be a 50 by 50, and now, because of the way it was lined out with the trees and whatnot, it's going to be a 40 by 60. So basically, the size of our office, our main office at Horse Plus. We've been discussing a lot, and I had a meeting with the vets this morning, and we're trying to build this the absolute right way. And because it's a spay neuter clinic, but it's also where all the dog and cats will be. The dogs won't be living in this building. There'll be another building for the dogs. So they'll be able to get fresh air and then have a nice area to go in where it's warm. But it's a complicated situation. Maybe because I've built lots of horse stuff. Just haven't built a spay neuter clinic before. But all the buildings at Horse Plus, I designed them all, and they're all functional. So hopefully I can get this one right, but I always love input. You're all welcome to send in input too. It can get too complicated if too much input gets involved, and people that can actually be here and see what works with the land and stuff, that's very helpful too. But you're welcome to send your input along with this if you'd like. We are going to hit the road and go to High Forest and see their fundraiser. Hopefully it's going well.
Okay, we're here at High Forest. We're bringing in all the toys, and we'll be going inside pretty soon. Hi, babies. Cutie.
All right, we've got some dog toys for High Forest, and they're doing a Facebook Live fundraiser. So it sounds like they're very busy back there. We're going to hang out and wait. So I saw the county mayor, and he had a pie that got thrown in his face. But very interesting stuff happening here today.
Yeah, it's very interesting. I'm so glad to be able to be here. I've never actually been to High Forest facility before, so it's really great, all the hard work they're doing. So awesome event here.
So yeah, they're doing a fundraising for High Forest over here. They've got their volunteers. I think people are dropping off donations and other things. So they're all hanging out here and doing a great job. We got this little guy over here. He's only got 3 legs. Hi, buddy. We got you. I don't know their names, but hi, everybody. Hi, buddy. Hi.
We're participating in a fundraiser. I don't really know what we're going to end up doing, but High Forest is an amazing organization. We are here to support them. It sounds like we might get locked in a cage. I don't know.
For 30 minutes.
I have no idea what all's going to happen. It's fun. But I did see our county mayor come out, and he had cream all over his face, and his clothes were quite dirty.
So we're at High Forest Humane Society shelter today. We're doing a fundraiser with a group called Jordan's Way. They were here last year and helped us raise money for our pets who really need adoption, and we need to raise money for food and vet services. So we do a lot of silly things to raise money, pies in the face, we get locked in the cages. We had Mayor Keltner get a pie in his face earlier. We've had some tortilla slaps with some of our volunteers. We are about to get locked in a cage. We have some locked in a cage right now trying to get out. So anyway, just a lot of fun to build awareness about who we are and about our animals, and really spotlight those who've been here for a while.
I want to say we're really thankful to have so many community partnerships. Horse Plus Humane Society, of course, being a big part of that. It's great to see so many people here, so many people invested in this cause of caring for those furry members of our community that can't very well care for themselves. So this is a great day for High Forest Humane Society. It's a great day for the animals in our care, and hopefully we'll be able to accomplish a lot of good.
Okay, I think Horse Plus is on team 2. We're going to be locked in a cage, and we'll see what the plan is from there. So we've got team 2 going in. We're all just going to pile in, I guess. Oh, goodness. Okay, so we're all getting in here. Oh, this is going to be lovely. Okay, so we're all in a kennel.
Where's my team captain? Okay, stay in the front.
She's team captain.
Team 2, give me your first name. Wow, team 2 is loaded. Team 2, give me your first names. Trisha, Heather, Bailey, James, Piper, OT. Here we go. Keep going. Eden.
Chandra.
Sean. Angela.
Haley.
Amy, is that what you said?
Haley.
Yeah, I'm sorry, Bailey. Bailey, your team's got 30 minutes, Bailey, to raise more than $1,150 set by Team 1. If you don't raise that money, everybody gets a pie in the face here. Everybody gets a pie in the face. Here, who's my team captain? Trisha, do me a favor. Where is it? Trisha. If you're just joining in, Maryland. If you're just joining in, Trisha. Maryland. Trisha, hold my pee, Trisha. Hold my pee. Show the team. If you don't raise 500 in the first 10 minutes, everybody drinks the yellow snow. Trisha, you ready? You're just a bartender. You're not going to drink anything. You're just a bartender, Trisha. Let's do it. That team's going to work their phones. Trisha's not going to drink it. She's just a bartender. They got 10 minutes all together right now to raise $454. They have 30 minutes to Team 1. Will they take a pie in the face?
I got 18.
1446. Is it disgusting?
She's eating the treat.
Not too bad. Guys, give it up for my friend Deb from the Chamber of Commerce.
So Tawnee just donated $100. And now we got a new challenge.
Trying to figure her first 30. She needs 320 more. 320 more.
We are in a dog kennel at High Forest Humane Society. I've seen someone eat a dog biscuit, a bacon dog biscuit. Someone else is going to eat a tarantula if the money's not raised. And there was urine they were going to make us drink. This is very scary fundraising. Do you want to say anything? This is Dr. Lydia's daughter.
Hi. I did this last year when they did this, and we got sprayed with the hose. We lost, we got sprayed with the hose.
So they donate enough money she doesn't have to eat the tarantula. Anyways.
Are you going to raise the last 300, Trish? If you guys don't raise 300, Team 1 gets to pie you in the face. Also, there, hi, Heavy. You guys have the last few minutes. Trisha, work your team. You got this team. You go.
I'm just hoping we can get this other $300 so we don't get pies in the face.
Pies in the face would be a whole lot better than drinking urine or tarantulas.
Donated twice.
Woo! Thank you!
It's going great. We are having a blast back here in the corner back here. And so we are back here in the corner holding up the wall. And we are trying to raise money here to get us out of the dog kennel. And we are having a blast doing it.
It's like some jelly bean stuff we'd have to eat if we don't raise enough too.
Jalapeno jelly beans.
This is us right now. We're on a live, and that's us in the cage with them in the front. Okay, we just got $50, another $50. We're $150 away. If we don't make that, we eat the very nasty jelly beans. There it is, the nasty jelly beans. We gotta eat those. We've got like less than a minute.
There's a Carolina Reaper jelly bean that's supposed to be very spicy. What do you think of this?
I think it's pretty cool. We got to take care of people and pets, so this is good.
Now, you ate a dog biscuit.
I did. A doggy treat. Bacon flavored.
How was it?
Well, I have to be truthful. It wasn't good.
Okay, we are stepping out. We're free. We are free from the cage. Good job, everybody who donated. That's awesome. This is for High Forest Humane Society. Oh no, what's going to happen? I think Team 1's got to get a pie in the face. Oh no, Megan, not Megan.
It's going to get really exciting. You guys are going to get messy. After they pie you, I need everybody back in line. line. I need you to just scrape it off and deal with it for a minute, okay? So get back in line. Both teams, all right? Stay here, don't move.
Team 2 got $2,500 raised.
All right, who from team 2 has the best throwing arm? Perfect. Here we go. Gage, stand right here. I want you to aim for the nose, Gage. You got to throw like a baseball. Like a baseball, Gage. 1, 2, give it to her.
Oh, goodness.
All right, everybody else, give me 2 steps closer. Give me 2 steps closer. On the count of 3, throwing. 1, 2, 3. High face. High face.
Perfect.
Get your face clean.
Megan's face is clean. Everybody else.
Everybody back in line.
Okay, if there's one donation, team 1 gets to get revenge and egg team 2 now.
40 seconds. If they don't raise it, Penelope, your team's going to get egged if you raise nothing. It's 1 donation. Just 1. 26 altogether. Almost 3,000.
Okay, they might get egged. Okay, someone just donated $15.
Like it. Everybody else, go get it. Go get it.
Oh, Maggie. Oh, goodness. Oh. Oh, Tawnee. Oh, no.
What a nice conditioner.
Oh, no. Someone's getting slimed. But we have to go back to the shelter, so they're going to do another round where team 1 versus team 2 for a mega round. But we've got to head out, so we're going to post the link up later today and show you guys. But even though it was a live, maybe they'll still have the donation link up. And another slime. Wow.
That'd be so cool.
It was definitely a wild fundraising event, but we have some panels getting delivered for our quarantine expansion. We're going to have to take off, but check out High Forest Humane Society. I know you saw some of one of our dogs here.
Yes. It's Medusa. I saw Medusa in here. So this is where a lot of our dogs get transferred. And then they go into their adoption program, which they have an amazing adoption program.
So we're really good at getting animals taken care of and ready for adoption. And our focus is horses. So we partner with organizations like High Forest so they can do the adoption part. Because we have the medical team, the vets, everything, like get them spayed, neutered, ready for their homes. And then we work with organizations like this. So we came out to support High Forest today, but we got to get back to the shelter now before something bad happens here.
So yeah, we got to head back to the shelter, but they're going to continue doing the fundraiser. All the little doggies out here, and then we're going to head back. We noticed that they gave out some of the toys already that we brought. Do you like the toy, buddy? Yeah, they got the toys. Got the little snuggle buds. Okay, we made it back. We're back at Horse Plus. So apparently we have a delivery of about 65 panels coming in between 1:30 and 2. So I'm going to get that. And then right now Ryan's working with Zora. And then the vets have one more spay to do, I think. When we went to High Forest, they were doing spays and neuters. So I'm going to get that whenever they get ready and they get back from lunch. I thought I'd say hi to Bruno and Blue Jeans, but they ran away from me. Can I get a little closer? Nope. Okay. That's Symphony. I think the vets are actually going to take a look at her today. Check on her. Guys, Allie really needs a home. Don't you, sweet girl? I'm not sure which horse this is, but it's one of the Mustangs. Hi, buddy. My little tugs. Up. Would you quit that? Okay, Emily's got Flower. She's the last spay for today. So she's going in for her operation.
No, sit.
Super sweet girl. Jordan is also refilling round bales out in the pastures because we need more. We got lots of horses. The hay runs out pretty fast. So Tawnee has caught Bo. They're gonna do a dental, I think, on him. So they'll do a dental and I think then the spay on Flower. He's like, I don't know what these are. It's just mats, buddy. You got this. There you go. Good boy. There's the panels. Yeah, so the panels are here and we're gonna unload them. So it looks like they're putting all the panels over here and then putting the doors in a separate pile. And I'm just gonna lay them all out over here, but they got all the doors out. Now it's on to the panels. Okay, I'm gonna go see if they've started the spay on Flower real quick, and we'll come back after they get all the panels down. Okay, we've got Flower here. We're trying to do a spay, but we may think that she's already spayed. We're trying to see.
She has a pretty significant scar and a lot of adhesion, so I'm being extra careful. When you open into the GI tract, if you have scar tissue that's like happened in the abdomen, you can have parts of the GI tract attached to body wall. So I'm being really, really careful with opening here to make sure that I don't. This sweet girl is Flower. She's a lab mix. She came to us as a stray, and it's always tough for us vets when we don't have 100% confirmation, no medical record, no medical history. Flower had a scar that was in the same spot as a spay incision would have been, but she didn't have a tattoo, and the scar was really small and really faded, and sometimes we fix hernias in puppies. Anyway, she has very small nipples. She has an underdeveloped vulva. She had all of the external signs of a dog that's been spayed, but if we're not really, really sure as a shelter, we have to make that call, and we don't want to adopt out intact animals. So I opened Flower's abdomen very carefully today and was able to visually and via palpation confirm that. So the reproductive tract lies between the bladder and the colon. It's the only place where it is. That's where it exits the body. So we can kind of gently lift the bladder up and look. And she had no indications of having any reproductive tract. And I palpated kind of her whole abdomen, didn't feel any ovaries, wasn't able to palpate a uterine stump. But that stump is all the way back here sometimes. And I only make a little incision right here. So I didn't want to traumatize her further. I'm about 98% sure that she had already been spayed. In cases like this, what we always do is message with the new owners and just say, hey, if this dog happens to come into heat, please bring her back or take her to your vet and get her spayed. But I'm pretty confident that she'd already been spayed. So it is a toss-up. You know, we did have to make an incision into her belly and she'll get some good pain control. She had a local block to block that area. but we want her to live a healthy, happy life, and we know that her best chances of doing that as an adopted pet is one that's been spayed. So she got a couple of vaccine boosters and a microchip, and she's going to recover. And then we actually already have somebody interested in her, so hopefully she'll get to go to her new home soon. You can see by the pile of our laundry that we've generated today how many small animal surgeries we've gotten through. A lot of animals spayed and neutered, mostly spays today. And I think all of the animals that we did surgery on except 2 have people who are interested in them.
That's great.
So that is always exciting for us. Oh boy, can you hold the crate, Emily?
Yep. It is actually all but one.
Okay. All but one?
Mm-hmm.
Our kitty?
Our kitty, yep.
Good boy. Do you need a minute? I'm going to walk through here. Good boy. Can you take a few steps for me? Good boy. Good boy. Whoop. Good boy. Very good. Whoop. Good boy. Oh my goodness. You see how all the dead ends? See all of those? Those are already dead hairs that are unattached. They just can't fall out because they're stuck in a tangle.
Okay, Dr. Lee is giving him a poke.
He needs to go to sleep so we can look at his tooth. I hear what you're talking about. It sounds aortic, like PMI sounds higher, and I don't hear it on the right. All right, I'm going to try to put a speculum on him and see what happens. This super handsome boy is Bo. Bo came in through our buyout group last month. He was cleared from quarantine. He was quarantined by himself because when he got here, he was in really, really horrible shape. He had nasal discharge and large lymph nodes. He actually was lateral in the trailer, and we were very, very concerned about him. He had a very strong infection, and as you can see, he did great in quarantine. He gained a ton of weight. His lungs sound great. Dr. Jean and I both hear a little bit of a third heart sound associated with the aortic valve. It's very slight, and he is sedated right now with 2 different drugs, which is hard to believe. He doesn't look very sedated. He is not a lightweight. But we're going to put the speculum on and take a look at his teeth today. If he has any dental work that needs to be done that we can do for him, we will go ahead and do that work. And hopefully we'll get him into our adoption program soon. He's only 19, and he's a bit high-strung. He's very difficult to catch, but he's gorgeous, and he looks to be a full-blooded Arabian, although we never know what their histories are. Unless we look in your mouth. Don't hit anybody, okay? Good boy. Very good boy. Good boy. You've got fantastic teeth, sir.
Does he?
He's got a little tiny hook.
Cool.
Little tiny bit of a lingual ridge. Really, overall his mouth looks great. He does need a little bit of some work. Yeah. Sorry, Emily.
She got me. Oh, it's warm. Ew.
I think somebody took care of this horse. I don't know what happened to him, but... Okay, I want to take a little bit more off this top left. That's the last thing that I need to do. Those were some pretty big points. We finished Bo's dental float. He had a bunch of teeth with some sharp points, only 2 that were significant, and those all smoothed out really nicely. He's got a great mouth. I think he'll do fine just with an annual dental float. He needed lots of drugs. We had to up his drugs 3 times before we could get the speculum on him. Normally, if I give horses as much as he has had, they're barely standing up, and he is pretty awake. But he was a good boy. I'm happy about his teeth. He's sound clinically, non-weight bearing, so we want to assess his lameness, but we're going to wait until he has a riding evaluation and see if we can assess his degree of soundness under saddle.
Okay, until he wakes up, he's going to be in here, and then they're going to release him back into the pasture. So he's going to stay in here until he wakes up. Okay, we got some more shavings in. It looks like Keith went and got some more in town, so gonna stack those up now. Okay, we got all the shavings unloaded. They're all stacked. Oh, okay, last one. But it's right. So they got the panels unloaded. All of them here. There's 65 panels and then 10 man gates that are over here. So, got 10 of those. And then 65 panels. So it looks like Miss Sage is being gentled right now. She's back in the round pen. She's got her saddle on, got those little obstacles. Okay, Tawnee just let Bo loose. He is all good to go. He's going to stay here, I think, overnight. I don't know if he'll be moved back to the other pasture, but I think this might be his pasture now. If so, he'll have a pasture mate with Sage if they leave him in here with her. But he's free. He's no longer in the stall. Okay, on that note, I think I'm going to go ahead and end the vlog here for today, guys. Thank you all so much for watching, and we'll see everybody tomorrow.